The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. My son's team is working on safety crossing the street. I love this, but I am just terrified. How will they know when he truly has it? I live in fear of the first time they let him cross the street by himself. Can you talk about mastery when it comes to safety goals?
Yeah, that's a hard one, right? And depending on how good the team is and how many resources, I guess, they have, you could definitely continue to kind of manufacture the setting so that it gives you some ease. So in other words, they could select a very empty area of town or a street that has very, very little activity going on. Pick a weekend morning when no one's traveling and have a couple of the therapists or people cousins, nephews, whatever, drive with their cars to see if your child has actually mastered look right, look left, look right again, and there are no cars, now I can go. So you can extend, I guess, the end of that scenario to the point where you really feel comfortable, or a little bit more comfortable, I'll say. But this is true. It is difficult with safety stuff. Like another area of safety, obviously, is strangers and knowing not to interact with or go with strangers. Another area is consumption of hazardous materials, like chemicals. And so when we teach those things, we will take the setting and expand it a little bit further. So we will actually make fake chemicals that are harmless and put them under the sink in a container that looks like it should not be had, and then we will observe to make sure that the child is not actually going to ingest those. As you know, Shannon, we have a pretty extensive stranger program to teach kids to identify who would be a stranger and what they can do actually if a stranger does come up to them. So yeah, these things are very important. I completely get it for parents. Let me tell you, all parents of neurotypical kids have this anxiety as well. Look at it in terms of, thank goodness that you have a team of people who are working on this. Because let me tell you, with all of our kids as they were growing up, we were all afraid, do they really know how to cross the street, right? So it's a gradual process. And if your team sets up the manufacturers and makes the scenario all the way until they have cars that are safe because they're driven by people, then you'll get a little bit more assurance.
Yeah, I always try to be careful about, there's a saying that my friends and I use about, not blowing rainbows up people's tuchuses, right? But I do think that sometimes if we stick around long enough, we see that there are some blessings in our lives and the way that our lives shaped up. I don't think any of us would have been like, oh, sign me up, I want to have a child with autism, and I'd like to be doing ABA therapy. I don't think that was on anybody's bingo card as a woohoo, I want that. But I want to tell you that I don't think it was last summer, I think it was 2 summers ago, they were having this show on during the summer, and it featured parents and parenting styles. And they would show, the kids would be put through a challenge, you would meet the family, each set of parents, and I think there were 12 sets of parents, had this philosophy. There was the progressive parents and there were the strict parents, and all these different parenting types. And then they would put all of the kids through a challenge to see how they would deal with it. And the one where it got really, they had to stop filming for a minute because one of the dads fell apart. was that they did a stranger danger test. And all of these parents had in some way talked to their kids about stranger danger, but they set up a circumstance where the parents were in the house, but in the back of the house, somebody comes to the door and says, "Can I come in? Can you come to my car? There's puppies in the car. I need help. What should I do?" Da 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 da. And almost all of the kids, and these were all neurotypical kids, almost all of them failed it.
Yeah.
Almost all of them. And
Yeah.
and I remember sitting there and thinking, oh, but you got to rehearse it. And one of the things that I love about ABA is that we get to rehearse and rehearse and rehearse and rehearse, and it gets in your body so that, eventually you can do it for your own. And you guys did this with my son. And let me tell you, I had a fair amount of anxiety while you were doing it because I knew the day was going to come where we're going to put it to test. Now, you did the test in a way that he was so safe. You had undercover people in a Walmart store. There were like 5 people in the store. They had plotted out this thing so they were all standing in these different places. I was at home because everybody knew I couldn't do it. My husband was there, and there was a set time when my husband was told to walk away. They had cameras on him. A stranger came up to him, and he had rehearsed and rehearsed and rehearsed, and he did. He passed the test with flying colors. I just want to say that sometimes, if we can find gratitude in that we have, if your child has a diagnosis, you likely have funding to get help and support with these kinds of things. Now, the thing that I run into with myself and with a lot of parents is that we have these competing values. One is we want our child to be independent, and we want that fiercely, and we will fight you because we want our child to learn skills to be independent. But on the other side of that is that we want our child to be safe. We want our child to be safe, and we don't want you to do anything and sometimes those two values go boom, 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 boom. But with rehearsal, you guys got me to the point where I could allow him to learn and practice and show me that he understood the concept and could do it. It's so funny to me now, Dr. Granpeesheh, because I can remember him being 4 years old and just sobbing because I thought, I'm never going to know that he's going to be safe crossing a road. I'm never going to know that. And just sobbing. Yeah. And he's 21 and he crosses the road all the time and I don't even think about it, which is a lot. That's huge.
No, of course. I totally understand that. And I think if you think about it, Shannon, as a parent of a child on the spectrum, you have so much more trauma around the independence stuff, right? It's like it's a legitimate concern to be overprotective is what I'm trying to say. And so parents good parents are taught by reality that they have to be more protective. Yeah. So now trying to get that parent to let go and allow the child the freedom to learn these things is a difficult journey. There's no question. But you are right. Everything that we do, and especially when it comes to things like safety, which are, by nature, you can learn safety in a clinic, but it's never going to generalize unless it's actually on the street, right? So with a car or with strangers or so on. So safety is one of those things where the generalization of the skill matters a lot, right? So all the rules that pertain to staying away from strangers and all that sort of stuff, those are very, very important. Those types of things we really do get to rehearse, and that is a privilege because, as we all know, as you said, with neurotypical kids, we can only hope that there's some lesson in their day-to-day lives that keeps them safe. Because too often, it just doesn't occur to parents that they need to teach these things and rehearse them, because it is possible to trick young children.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.